I'm Dr. Steve Folstead of Vein Clinics of America with offices in Wilmington and Charlotte. We had to redesign all of our usual operating procedures with COVID. We have rewritten policies regarding mask wearing, hand washing, cleaning of surfaces. Patients are brought in and out of the clinic in a very controlled manner as to avoid as much interaction as possible. And all of this is done just with the sole intent of keeping our patients and staff healthy. We have recently begun to offer teleconsults, which can be done over the computer and avoid the risk of having to come into the office to be seen. The veins are intended to bring the blood from the tissues back to the heart and lungs. That means that the blood going up your legs has to travel against gravity. Veins have developed valves. These valves are meant to be one-way valves that open when the blood flows up your leg and close to keep the blood from flowing backwards. If those valves fail, then the blood flows backward down your leg. It pools in the lower legs, dilates the veins, increases the pressure, and this is what leads to the symptoms and complications we see with vein disease. How do you tell if you have vein disease? The most common symptoms are aching, heaviness, fatigue, sometimes throbbing and itching, and these are seen mostly after a day where you spend a lot of time on your feet or whether you sit for prolonged periods of time. Our primary age group that we see is in the 35 to 60 range. However, vein disease is certainly encountered in both the older and younger populations. The treatment of the vein disease is based primarily off of the ultrasound findings. We have the ability and the technology to treat everything from the more advanced endovenous ablation procedures all the way through to simple treatment of cosmetic spider veins. Insurance covers almost all symptomatic vein treatment, as well as does Medicare. At Vein Clinics of America, all of our doctors do vein care 100% of the time. And we offer all of this in an outpatient, comfortable setting where people can return back to essentially normal activities the same day.